Pap smear, also known as Pap test, is a medical procedure used to screen for cervical cancer in females. This test is also capable of detecting changes in cervical cells that may potentially lead to cancer in the future. The cervix is the lower part of the uterus that connects with the vagina. Detecting cancer in its early stages is crucial for effective treatment and patient well-being. Now, let's explore how the Pap test is performed to detect cervical cancer. During the test, the female candidate lies down in a straight position. The doctor gently inserts a speculum into the vagina. This instrument helps to open the walls of the vagina, allowing access to the cervix region. Next, a soft brush or a scraping device, called a spatula, is used to collect samples from the cervix. These samples are carefully preserved and sent to a laboratory for examination. If the cervical cells appear normal, the test reports are considered negative, and no further checkups are required. However, if abnormal cells are found, the test reports are considered positive. In such cases, the doctor will guide the patient for further steps and necessary treatments. Thank you for watching.